There we go. Perfect. So, welcome you guys. So, again, tonight we are covering crisis, what exactly a crisis is, the phases or stages of a crisis, how nurses can help clients through a crisis. Okay, now this is something that'll probably help all of us, and this webinar is going to go a little different than what it normally does because instead of us covering an actual condition, we're just covering the theories of crises. So when we go through our NCLEX questions, it'll be more towards how you would handle a crisis, how you would respond, what would be a priority in a crisis. And maybe this can help you guys also because we've all experienced some form of a crisis at some point, both expected and unexpected. Okay. Now, when you guys are preparing for the NCLEX, one of the client categories that is on the NCLEX is safety. Okay. And when it comes to a crisis, that's one of the main concerns that we have for people, the safety of the individual. Either they are caught up in a crisis or the aftermath of the crises, because both situations can be a safety concerns, especially if an individual doesn't have really good, effective coping skills so that they can handle the aftermath that comes with dealing with a crisis. Okay. So I'm going to go ahead and get into slideshow view and then we can go ahead and get started. So we're going to take about 2 breaks, maybe 3, depending on the time. And then we're going to go right into our NCLEX review questions. Okay. So first things first, these are the objectives for tonight's webinar. Okay, so you guys will get a better understanding of what exactly a crisis is. Okay, the breakdown, what goes into a crisis cycle or the phases, stages, and then again, how to help manage an actual crisis when it comes to someone, a client, or just someone in general. Okay, so first things first, just general information on what a crisis is. So, what is a crisis? Okay. So, a crisis is any type of a situation that can be threatening or it could cause harm. Okay. It can interrupt daily life. It can damage a reputation. It can ruin a business. It can ruin a school. Basically, anything that causes harm, it could be expected or unexpected. Okay. Yes, there are crises that we try to prepare for. Okay. We know that something is coming. We know that it can have a major impact. So we try our best to prepare for it. Even if we don't prepare 100% and we are still affected, we still try to prepare. And then you have those unexpected crises that just comes about and you weren't expected. It caught you totally off guard. So we'll talk about both types of ways and we'll talk about how it affects individual lives and of course how you can help work through it. Okay. Now a crisis could be something personal. It could affect an individual by themselves. It could affect the family as a unit. It could affect the community. Okay. It could affect organizations. Okay. Now, what helps people when it comes to a crisis is how they manage it. Okay. Now, of course, you can't prepare for every crisis 100%, but you can have what we call effective coping skills. So when you do come across a crisis, you're better able equipped to handle it as well as the aftermath. Okay. It could be a wide range of issues that can call a crisis. It could be something emotional. It could be something distressing. It could be something mentally challenging. It could be a physical crisis, a health crisis, relationship, financial. So many things can cause a person to go into crises. It's so important that we're able to effectively cope because a lot of times a crisis can have a very big mental impact on the individual in the aftermath and the time moving from the crises that actually happened. Okay. So, impacts of a crisis. Now, a crisis can affect the person in many different ways, okay? Psychologically, socially, as well as economically. So, when it comes to psychosocial effects of a crisis, there's an increased risk for the person developing a mental health condition following a crisis, okay? This includes depression as well as anxiety. Now, of course, there's others, but these are the two main aftermaths of a crisis that a person can get into when it comes to mental health. So, depression and anxiety, especially if the individual is not too great with handling the aftermath of the crises. Again, effective coping. Okay. It could also cause severe emotional distress. Now, there's nothing wrong with, reacting emotionally to a crisis. Okay. Especially if it's something upsetting, if it was something that was, unexpected. Of course, you have feelings about the crisis. Of course. Okay. But again, that is the psychological aspect. And hopefully, okay, someone has what we call an effective coping skills, a good support system, okay, or the resources to help rebuild if they are very affected by a crisis. Okay. I'm sorry, you guys. Give me 1 second. Like I'm experiencing some interference. Give me a second. It's the weather's a little bit crazy here. Give me. Okay, you guys, I'm good. It said like my Wi-Fi connection was a little spotty. So I just had to make sure my Wi-Fi was great. So, social distress or social impacts of a crisis. Okay. Now, this is something that we all know too well when it comes to the social impacts. Now, I'm going to use COVID as an example because that was a great, example of how a crisis can affect communities socially. Now, one of the things that the crises can do, it can disproportionately affect people. So, for example, vulnerable populations are affected more severely than populations that are affluent. So, I'll give you a perfect example. So, COVID was something that broke out all over the world. It wasn't just, areas of affluence, meaning areas that, higher social economic classes, lower social economic classes. COVID did not discriminate, it hit all over. However, there were some places, okay, that were better equipped to handle the COVID crisis. Even though we didn't know what we were dealing with, some places they did handle it a lot better. Now, everybody, of course, experienced the negativity of COVID, the hardships of COVID. But again, some places fared much better than others. And when COVID broke out, you saw the disproportion when it comes to vulnerable communities. Okay. Some places were devastatingly hit. Some places it took a while to recover. And then you had countries like the United States, countries like Canada, countries in Europe. They were better equipped to handle it. Once they got a hold on it, they better served the people. They better served the communities. Okay. You had some populations that weren't that, prepared in terms of resources, in terms of personnel. Okay. And then you can also look at the other aspect of it. COVID also I want to say it kind of shed a light on the nursing shortage. Okay. Now, when I was in school, hello, Texas. Now, when I was in school, okay, I remember that, and we're talking like the early 2000s, right? So I'm kind of revealing my age a little bit. So when I was in nursing school in the early 2000s, I remember reading that there was going to be a million nurse shortage in the year 2020. So I'm talking early 2000s, right? So I'm like, wow, a million nurse shortage. That's a huge shortage because people were retiring, more people getting sick, more people being born, the population is growing. So there's going to be a shortage. And then look what happened in 2020, COVID. So COVID really shed a light on the disparities when it came to the nursing shortage. And that is what a crisis does. It kind of highlights deficiencies in areas where you weren't really even, sure there was a deficiency or you didn't even know that there was a deficiency. So COVID really exposed a lot of things throughout just this country and other places as well. So that is what is meant by a social, okay, breakdown or social disparities. Community cohesions can be disrupted. Okay, a lot of times you have communities that are in very rural areas, which means that you have to travel to reach them. There's not a lot of resources. The nearest hospital is miles and miles and miles and miles and miles away. So when something happens, they can be cut off, those communities. So it's very important that when it comes to crisis management or even crisis preparedness, we think about those areas or those things that could leave an individual or community vulnerable. Okay. And then you have the economic impacts of a crisis. COVID again, job losses. Okay. A lot of people suffered financially when it came to COVID. Not only did they lose their jobs, some people lost their homes, they lost insurance coverages. And then people got really, really, really sick. And it's like, how do I cover this? How do I take care of myself? How do I take care of my family? Because I'm not bringing in no money. Or incomes were cut in half. Okay. So crises can definitely have an economic impact on an individual or the family, depending on, again, how prepared they are from the beginning. Okay. Now, public resources, infrastructures. Okay, crises can also interfere with that. If you think about a crisis that hits the community as a whole, or such as another outbreak, I'll use the flu, for example, because that's something that we deal with every year. The flu, the flu, the flu. The flu didn't go anywhere. We just put so much emphasis on COVID. So let's say a community breaks out with the flu. And now you have to say, okay, what resources do we have for this community? Sometimes, if a crisis is unexpected, you're not well prepared, resources are cut very, very thin. Infrastructures definitely do suffer when it comes to crises. Okay, infrastructures are like the foundation of a community, the foundation of a business, the foundation of a university. So, a lot of times when it comes to crises, if you're not well prepared, there's definitely impacts that you see, when it comes to the aftermath or just working through the crises altogether. So, again, psychological impacts, social impacts, as well as the economic impacts of dealing with a crisis. Now, there's two main types of crises. Now, there's other types, but these are the two main types that we see, especially as we move through our lives. And a lot of times we go through crises and we don't even realize that we're going through a crisis because, again, we're just better equipped to handle them. So, the first type of crisis is called a maturational crisis. Okay. Now, this is not necessarily a bad thing because when you hear the term crises, you always think bad, bad, bad. Right now, a maturational crisis deals with development. Now, of course, from a child up to an older adult, you go through different developmental stages. A lot of changes happens in your life as you grow up, and sometimes it can create a crisis for the individual. For example, puberty. Okay, puberty is a major change in a child's life, both boys and girls. So, for some kids, when they hit puberty, okay, depending on the changes that they experience, that could be something they're not emotionally ready for. They're not mentally prepared for. So, it causes distress, it causes a crisis. Right. Another big momentum maturational crises, leaving home and going off to college. If you are a child that's never really been away from home, you might be an only child, and I'll throw myself into that example because I'm an only child and I went off to college. Okay. I live in Miami and I went to Florida A&M University, which is in Tallahassee. So for me, being an only child, okay, living at home, always been sheltered a little bit, overprotective parents. For me, going off to college, moving into a dorm, that was something very, very new for me. And honestly, I was nervous, I was anxious, I was scared, I was all of that. And even though it was a good thing, I'm going off to school, I'm going to get an education, it was still a crisis for me because it was such a big change in my development. Okay. Getting married, getting divorced, getting older. Okay. Those are all maturational crises. And again, they all deal with development. Okay. It's like nature, it's a cycle. It's just some things that you can't avoid. Okay. But again, it's a part of life. And even if it is a part of life, even if it's something that we are expected to do, it can still cause crises for us. It can still disrupt our lives. It can cause us emotional distress, again, financial distress. Because I'm pretty sure for my parents going off to college, even if I did have scholarships, I'm pretty sure I still burned through them pockets a little bit. Okay. Um, think of it as just typical transitions. Again, things that we go through in our life as we grow up and as we get older. For you guys that's coming up, getting ready for the NCLEX, okay, this is a part of what it is that you chose to do in terms of your education. So even though this is still a crisis for you, okay, preparing for the NCLEX, you're nervous, you're anxious. It's stressful. Okay, this is all you guys are focused on: studying for the NCLEX, studying for the NCLEX, passing the NCLEX. And even though it's a great thing that you guys are preparing for, it is still something that is causing you distress a little bit because this is a stressful thing. I remember when I was preparing for the NCLEX. Okay, especially knowing that there's no exact blueprint to study for the NCLEX. So it's like, you guys are just kind of winging it in a little bit of a ways because you have no idea what to expect when you sit down in front of that computer. So that is what we call a maturational crises. And then you have those situational crises. These are the unexpected crises. These are the, occurrences that you had no idea was happening. A big one would be a sudden death. Okay. Even though death is never easy, when it is a death that you are kind of sort of expecting, it makes it, I won't say easier, but you're better prepared because you were expecting it. Like, for example, an older loved one, or someone that is really, really sick nearing the end, you're kind of, you're preparing for it. It's not something that's going to catch you off guard. But when it comes to those unexpected deaths, those traumatic deaths, those are the types of situations where you have a situational crisis. Okay. Um, Not only does it interrupt normal daily functioning, okay, it also causes emotional breakdowns. Okay. When it comes to a situational crisis, you can be unprepared. I'll give you a perfect example, a tsunami. Now, a lot of times when it comes to natural disasters, we try to prepare for them. Me living in Miami, Florida, and a lot of you guys that's on the East Coast, you guys know it's hurricane season, right? Hurricane season started June 1st for us, and it ends November 30th. So we are in a state of preparedness, right, when it comes to hurricanes because we watch for them. However, when it comes to a tsunami, those are things that happens without warning. Look at all the past history of tsunamis. Okay, how many times were people actually prepared for the tsunamis that hit their country? I don't think pretty much anyone knew it was coming. It was too late by the time they noticed. Earthquakes, those are another types of natural disasters. You cannot prepare for that. Sometimes people do study them. People do have an idea that an earthquake might happen, but again, might happen. We can't say for sure, yay or nay. So a lot of times natural disasters are situational. Okay. Your car suddenly breaks down. Your car suddenly breaks down and you don't have no money to repair it. That is a situational crisis. Okay. These are things that are out of your control. And even the most control freak still can be a victim of an unexpected situational crises. Now, when it comes to those unexpected crises, these are the types of crises that have the big impact on your life. Okay. These are the types of crises that leaves an impact. It leaves a mark. Those are things that can follow you. This is why people are so much at risk for mental health disorders like depression and anxiety. Okay. So even though you try your best to be prepared for life unexpected occurrences, they still happen. They can still catch you off guard. And again, you can still be kind of caught in a situation where I don't know what it is that I'm going to do. Okay. Or you're so emotionally distraught, you can't rationally think. Okay. So defense mechanisms, very important. Now, a lot of times when people deal with things that are uncomfortable or people deal with situations that are distressing emotionally, physically, mentally, a lot of people will utilize what we call defense mechanisms to help them cope with something that is difficult. And a lot of times when it comes to crises that happens, sometimes people go into defense mode. It's like a way to protect themselves. It's a way to protect their feelings. So a lot of times it just, it's just the way that the person reacts. And when it comes to defense mechanisms, those could be a sign that the person does not have effective coping skills. And I'll give you a perfect example. Okay. When a person deals with, I'll use another example of a natural disaster, right? A hurricane came through and destroyed your home, or tornado came through, destroyed your home, a flood, a fire destroyed the home. And, sometimes people are in denial about the loss that they have experienced. They're in such a state of shock that it's almost it's too big to even think that this is really happening. So it's almost like the person goes into denial. Like this didn't really happen. I didn't just lose my house. This is all a bad dream. I'm gonna wake up from this bad dream and my house gonna be there. My photos, my everything that I just lost is a dream. It didn't really happen. Denial is a big way to protect yourself, and a lot of people go into denial when it comes to crises. Okay. Another typical type of defense mechanisms that we see in younger people would be regression. A lot of times people go backwards in terms of development when it comes to a crisis. It could be so impactful that a child will go backwards because we deal with children in crises also. So this is not just something that is, referencing an adult reaction. We're also talking about children because children can experience things also that can impact their mental well-being. Okay. Projection, when someone, I'm angry, I'm upset because of something that's happening to me, but I'm going to take it out on somebody else. I'm going to project my anger onto someone else. My emotional distress, I'm going to project on another person. So when it comes to defense mechanisms as nurses, okay, especially if you're going to go into mental health, you have to be aware of defense mechanisms that a lot of people utilize, sometimes unconsciously. It's like they don't even realize that they are utilizing a defense mechanism. And again, this is a natural way that people will try to protect themselves when they are in danger or they have experienced a crisis and they're in the aftermath of it or they're in a threatening situation. Aftermath of it. Defense mechanisms can help reduce anxiety. Okay. A lot of times when it comes to a crisis or a threatening situation, you have anxiety. Okay. And we all know how anxiety works. You have mild anxiety, moderate, severe, and then you have those full blown panic attacks. So, a lot of times, a defense mechanism is a way to subconsciously protect individuals' mental psyche. Okay. So we just went through the general information when it comes to a crisis. Let's take a quick 10-minute breather. It is 9:50. I'm sorry, 9:40. So we'll come back at 9:50 and we will run through the stages of a crisis. There are four stages. We're going to break down each one and then we'll give some examples and we'll talk about how to work through each of these stages. So we will be back at 9:50.
Thank you, Professor. Please, can you return it back to the table?
Oh, sure, sure, sure. I'll leave it on while we're on
Thank
break.
you.
Okay, hopefully everybody's back. Let's continue. Okay, so now we are going to get into our stages of a crisis. Okay, so there are four distinct stages. Okay, pre-crisis, crisis, response, and then post-crisis. So what we're going to do, we're going to talk about each type of stage, and we'll just get into a little bit of the information and what exactly happens with each stage. So stage one. Okay, this is your pre-crisis stage, or also known as a prodromal stage. Now, with this stage, this is usually when there is some type of an indication that something is wrong. Okay, and this indication can come from anywhere. And a lot of times, unfortunately, we miss these signs that something is impending, something is going to happen. Like there's an issue brewing, but we may overlook it. It's not always, flat out in front of us. Okay. Now, this could be, you had a conversation with someone and you realize something like, wait a minute, you kind of had a thought like, wait, whoa, where did that come from? Or it kind of made you think about something that you weren't currently thinking about, right? Um, a symptom, because a health crisis is also a crisis. So this can be a symptom or a sign that you are experiencing. Now, when it comes to health scares or health crises, unfortunately, a lot of people ignore early warning signs, or they don't go to the doctor until they're feeling really, really bad. So when it comes to a health situation, okay, it could be something that, a lingering headache, a pain that just won't go away. Your appetite has changed. You're losing weight without really trying to. Your hair is falling out. Things like that is a sign, it's a symptom that you are experiencing, leading to a potentially bigger issue. Okay, in observation from a different perspective. So this is what I mean by you overlook things, right? Because especially if it's happening to you or it's something that you've gotten used to, you're definitely going to miss it. But let's just say somebody else, a friend, a family member, a coworker, someone makes a statement, someone has an observation, and it's from a totally different perspective than your own, and that causes you to say, wait a minute, you know what? I never looked at it like this before. Maybe there is something there that I'm missing. Okay. And then lastly, now from a business aspect, because there's business crises also, things that threaten, the longevity of a business, things that can threaten the longevity of a nursing school. And I'll give you a perfect example. A lot of schools are accredited when it comes to nursing because of NCLEX passing scores. Okay. In Florida, okay, now every state, of course, is different, but in Florida, for example, as a school for NCLEX pass rate, you have to stay within 10% of the state average. So if the state average is 80%, you can't be no lower than 70% in terms of first time passing rates for the NCLEX. Okay, if you drop below 70% as a school for your NCLEX pass rates, you can go on probation, and if you don't, bring your scores up, probation can turn into closing down of the school. Okay. So when it comes to statistics, sometimes statistics give you a heads up. Something is not right. If you're paying attention to the NCLEX pass scores for your organization and you see, listen, our pass scores are not good at all. Our pass scores are very low. This is something that is troubling because if we don't fix it, we can potentially go on probation. And again, if we don't pull up out of that, we can potentially face closing. Sometimes businesses aren't selling a product as well as they thought. They're losing money. Okay. And statistically, listen, we're not doing well in this area. We need to figure something out. Sometimes health statistics, a community health statistic. If anyone is interested in going into public health nursing, you don't work with just an individual. You work with the community as a whole. So you look at statistics of the community in terms of illness, something such as an STD rate, okay, poverty, okay, gang violence, anything of the sort. statistically, the numbers, the data, that's going to give you heads up. Listen, something is going on in this particular area. Let's look more into it. Okay. If you are in tune to what is happening in this stage and you act on it quickly and effectively, you can definitely reduce the chances of it turning into an actual crisis. Okay. It's like if you gain a lot of weight and you're pre diabetic and the doctor says, hey, if you lose so much weight, maybe your blood glucose levels will come down, your test scores will look a little better, and then you're going to avoid developing actual diabetes or hypertension. You lose a little weight, your heart doesn't have to work as hard, and now you're no longer hypertensive. So those are the things that you have to pay attention to. So again, if a person is aware, if a person is rational, meaning not in denial, very rational about what's going on, and they interject or they intervene, they can definitely ward off a potential crisis with this particular stage. Now, your next stage, two, this is the actual crisis stage. So now we're not in pre crisis, the crisis is actually happening. And this is also known as the acute stage. Okay, so now it is clear we are in a crisis. It is clear we need to do something. It is clear if we don't do something, this can go from bad to worse. So that is where you are in stage two. Now, let's say a person was slowly showing signs that they were developing a mental health issue. This is in the past. And you probably, wrote it off, you didn't think too much of it. Now the person has full blown developed a mental health issue, schizophrenia, mood disorders, personality disorders, whatever the case may be. Now they have full-fledged blown into an actual mental health condition, and it is causing them to have disruption in their lives. They're not going to work like they're supposed to. They are missing work. Their friendships, relationships are suffering. It's causing them to not perform well in school. Okay. And as nursing students, you can understand that you have something going on in your life that's causing you great distress. It is going to affect your performance in school, especially when it comes to your exams. Okay. Or it can cause you again to lose a job. Okay. What if you are suffering from depression and it's very hard for you to get up in the morning? It's very hard for you to get your day going because you're dragging yourself out of bed. And every day you're going through this and you're late for work all the time. And it can cause you to lose your job. So it is very clear that whatever is going on with the individual, it needs an intervention because you are in a full blown crisis at that point. Okay. What if you received a poor health prognosis? You weren't feeling so well. You go to the doctor, you get some tests done, some biopsies done, and the doctor comes back with not so great news. Even worse, you get news that you have a condition and the prognosis doesn't look good. You have a stage three cancer, you have a stage four cancer. Okay. You have kidney failure and you have to go on dialysis or something else. Okay. That is when, again, it is very, very clear that we are in a crisis. I have a health condition that does not look good for the outcome. Now, how do I deal with that? Of course, it is upsetting. Of course, it is emotional, stressful situation. And again, it can send me to a full spiral. Okay. Or again, a natural disaster. We talk about natural disasters a lot because there are some things you just can't prepare for. I can go out and I could buy all the water, batteries. Those of you on the East Coast, you know what I'm talking about. We buying water, we buying batteries, candles, non-perishable food items. We stocked. Some people got a generator. So if the lights go out, they could still run the electricity. We think we are prepared. We think we ready. And then a category five comes through and just blows everything away. And those of us in Florida have definitely lived through category five storms, more particularly for me in the sixth grade, I think I was. And I lived through a category five. So listen, the preparedness all in the world. It is not going to, lessen the effect of a crisis if it's something that is just big magnitude. right? Then when we talk about this stage, we look at something that is unknown to something that has a quantity to it. So for example, in the pre-crisis stage, something is wrong or something is giving hints that it is wrong, something is happening. However, when you're in this stage, it is not something. You can't put your finger on it. It's something, I'm not sure. In this stage, you are sure, you know exactly what it is. You could put a name to it. You could put a face to it. You could put a value on it. Okay, you can categorize it. It's a mild crisis. Oh, we can get through it. It's a mild crisis. It's a little setback. You fail a test. You upset. You distraught. But listen, you could shake back. You got another test coming up. Let's bring the grade up. It could be a moderate crises. Again, your car won't start. Okay, I need a new battery. It's a major thing because you're stranded. But listen, we could go get a battery and okay, we could be about our business. Or again, it could be a severe, major crisis. Again, like a natural disaster that comes through and just wreaks havoc on the city. So a lot of times you put a face to it, you put a name to it, you can put a finger on it. Hopefully that can help you at least start to prepare to act in that moment versus we're getting ready. We're trying to prepare because again, a lot of crises are situational. Remember, that means unexpected. I wasn't prepared for it, and that causes the major distress that we see. A lot of times when you are able to categorize or quantify a crisis, you can act. Okay, emergency response teams are activated, state of emergencies are activated. Okay, in Florida, you can have a hurricane watch. A hurricane watch means it's out there. It's not going to hit us just as of now. So we're just watching it to see what happens. And then a hurricane watch turns into a hurricane warning, meaning it's coming, it's expected to hit at this point. So what governors will do, well, our governor, he will call what we say a state of emergency because now this is no longer just a pre-crisis. Now it's an actual crisis. We have a storm coming our way. Let's go ahead and activate the emergency response. Let's put in a state of emergency so that we are prepared in the aftermath to help rebuild or restore. Okay. Sometimes publications can draw attention to something. You have no idea something is going on. Those of you who pay attention to the news, you see stuff all the time. Stuff that's happening that could potentially put you in full blown crises. Like, for example, economic hardships, okay, wars, fighting between countries that could affect the price of gas and things like that. Like for a lot of times we noticed when gas was particularly high, something was happening. There's always was something going on with gas prices spike. We're in the middle of a crisis. Why is gas $5 a gallon? Right? That is what you call, I'm putting a finger on it. This is not a potential. We are in the middle of an actual crisis. Y'all remember eggs was like $6 a carton. It's like, why is eggs so expensive? Because we were in the middle of a crisis at that moment. Okay. Or outside perspectives, notice a situation is problematic. Again, if a person is experiencing a defense mechanism, let's say denial, like the crisis is happening. Like it is full blown crises when you in the middle of it, but you are in denial and you're not even doing anything about it. Somebody from the outside looking in can say, "Hey, this is going on. You in the middle of something. You need some help." So a lot of times in the outside perspective, like for example, a person that has a drinking problem. Now you're missing work, you're going through withdrawals, you're dependent. And to you, it's not that bad. I don't have an addiction. I can stop anytime I want to. You don't realize how your life is being affected. You don't realize how your work life is being affected, your personal life, your friendships. You don't realize it's being affected in a negative way because you're in denial. So it takes somebody from the outside to say, "Hey, you are in trouble. You need help. Let's do an intervention. Let's help you." Okay. So stage two, you are in the crises. It is actually happening and affecting you. Okay. Stage three. Stage three. Now, this is the response. Okay. Now you are in a crisis. Now it's time to do something. Okay. Once you've gotten over the shock, because sometimes people go into shock, especially if it's something unexpected, you take a moment to kind of gather yourself. Okay, now it's time to act. Okay. And this is called the chronic stage because when it comes to the response, okay, depending on the severity of the crises, this can also determine the length of the response to get a hold over the crises itself or get control of the crises. So, depending, you may need to activate a response team. Okay. Most states, because every state is different when it comes to how nurses are managed, they have something called oh gosh. I guess every state calls it something different, but let's just say you are working in a hospital and there's a hurricane coming. What they will do is they will have response teams of nurses already predetermined. And team A stays 3 days straight at the hospital. You work 12-hour shifts and then you go to a room in the hospital, you sleep, and then you come back the next day. Okay. A lot of hospitals do that. And that is how they prepare for the disaster that's coming. Okay. So they kind of alternate with nurses. Doctors are the same way. Any type of healthcare professional, they have shifts where instead of leaving the hospital again, you're going to stay for 3 days straight. Sometimes they will allow you to bring family, especially if you have small kids, bring somebody with you. They assign you to a room so you can sleep because you're not going to be able to leave the hospital. So you better make sure you bring enough clothes with you, enough supplies if you have medication, because you're not allowed to leave based on the response system that was activated. Then it's time to deploy resources. Hopefully, there are enough resources to at least get control of the situation, but sometimes the resources cannot meet the magnitude of the crises. If you guys remember during COVID, the images on TV, New York was one of the hardest hit places. And we saw the nurses wearing, trash bags because they weren't prepared for the PPE that they was going to run through. They didn't know what COVID was, so they weren't prepared. So when you deploy resources, the goal is to hopefully have enough so you can get control of the situation. They were recycling masks in New York. I don't know if you guys remember that, but I'm like, these are nurses, these are my colleagues, and they're wrapping trash bags around their body and they're wrapping trash bags around their legs because they didn't have CPE. They didn't have the PPEs. They didn't have the mask. Can you imagine client's room and you got to use the same mask all day? You can't just discard it. Okay. Then you can have the response to prevent further damage control. Okay. The goal is to reduce the risk of this getting worse. Okay. In response to the crises. Okay. If there is something that I can do quickly to lessen the blow, that is what this is. And again, this could be, reaching out to others for more resources. This could be preparing for a strike too. Like, for example, sometimes with earthquakes, there's always one coming behind the other. So it's like we're preparing for it. We don't want any further damage. If there's a potential for a building to collapse, if there's a potential for a storm to knock over a building, let's evacuate. Because that is what a lot of we do in response. We evacuate, we do things like that. Okay, so this is about preventing or reducing the risk of something getting worse than what it already is. It's like getting ahead of something. Okay, open communication, very important. When people go through a crisis, they're already not probably rationalization thinking. They're in a panic, they have anxiety, they're afraid, they're in a flight or flight mode. When you're in flight or flight, you don't really take time to think things through. So when it comes to open communication, and this is also therapeutic, okay? Be honest. If I have to go on TV for those who still may have access, put a note out. This is what's going on. People don't want to be in the dark. It creates more hysteria. Okay. When we go through crises intervention with clients, okay, we openly communicate. We therapeutically respond. We ask open-ended questions to get the person to communicate, to talk about their feelings, because maybe that can calm the person down, that can lessen the effect of the crises. Okay. Strategic evaluation of circumstances. This can help you with management for the future. Okay. What did we miss? What did we not do right? If this was to happen again, okay, how do we respond? So this kind of, goes into the last stage when you strategically evaluate what is going on around you. Okay. So then you have stage four, which is post crises or the resolution. Okay. The resolution ties everything up. When you have a resolution, you're putting an end to something. Okay. So it's like for that particular crisis that happened, you have gotten a hold of it, you have gotten ahead of it, you're working through it, things are improving, and you can put that crisis to bed in sort of a way. Now this is a an acronym. This is not like putting it to bed, like, and you're done with it. Because we know a lot of times people are affected in the aftermath, right? But as far as the main components of the crises, you're kind of putting a lid on it. Okay. In this stage, you are now going to prepare for it to possibly happen again. Okay. Because if something happened once, it can always happen again. If you live in Florida or Georgia or any other of those states that's right along the East Coast border, you got hit by a hurricane last season, it can definitely happen again. We're always on high alert. Whenever something develops, we always paying attention because we need to know what's going on so we can better prepare. Okay. You evaluate your reaction. Did we deploy the response team quick enough? Could we have deployed them sooner? Was there something that we missed that we could have got the resources out quicker to lessen the effect? Okay. If you guys remember Hurricane Katrina, or those of you who do remember Katrina, that was a really huge, huge hurricane in 2005. It did pass over Florida, but it was not as strong as it was when it hit Louisiana. And they had a warning, so they knew it was coming their way, but somebody dropped the ball. Yeah, I don't know if it was the governor, if it was the mayor, but supposedly they had buses to evacuate. This was before the flooding. So if you guys remember Katrina, the levees broke, right? Because Katrina, New Orleans is a city that's under sea level. So anytime you have a city that's under sea level, they're at risk for flooding. So supposedly there were buses that were supposed to go out into the communities and take people to shelter. But somehow, some type of way, the response to activate the buses to go out and get people never happened. And all of these buses was just sitting in this lot flooded. And it's like you had the resources. What happened? Who dropped the ball? Who was supposed to give the okay to deploy to get those buses, and get these people out? And is there a possibility that had the buses did go out when they were supposed to, if those buses did go into New Orleans and get people out, would there have been that many deaths? That's a question that we can never answer, but one could think had the response been different, maybe the death toll would not have been so high in New Orleans. What could be strengthened? What could we do better the next time around? Sometimes it is okay to say, you know what, we are weak in this area. We need to improve in this area. It's not about being in denial. It's about being honest with, your performance. And a lot of times we need somebody unbiased to do this evaluation because some people don't want to admit they messed up or admit I could have did this a lot better. Okay. You learn from the mistakes or you learn from the event. That always helps you to be better prepared in the future. And you apply any improvement to enhance future crisis management. Anything that we see that can make us stronger, anything that you see that can make you better prepared, just go ahead and just put it into place. You don't wait for it to come back around potentially and okay, let's go with this idea that we had. Just go ahead and start doing it now. It's better to be safe than it is to be sorry, especially when it comes to crisis management. Okay. Learning effective coping skills. A lot of times when we deal with clients with mental health issues, one of the things you see is the nurse teaching the client how to deal effectively. Deep breathing. Okay. Relaxation. If you feeling yourself getting overwhelmed, remove yourself from the situation. Go to some place safe and quiet where you can calm down. If you see, you feel yourself getting overworked. Okay. All the things people do to relax when they are in a situation and they're feeling overwhelmed, they're getting upset. What do you do to calm down? Do you listen to music? Do you go shopping? Okay. Do you just take a little breather by yourself? A little quick overnight stay in a hotel just to get some time away. Whatever you do to effectively cope, we need to teach people how to do that. Because some people, they don't know how to effectively cope. Do you have a support system if something was to happen? If you ever feel a certain type of way, here's a telephone number for you to call so you can talk to someone. Okay. And then lastly, if it is an organization like a hospital or a school, a university, or any other type of business, okay, you may have to go back and change your management strategies. Okay. Sometimes a crisis can reroute an entire organization, totally change the way you do things. And sometimes change is good. People don't like change. Change can be scary, but change is also necessary to stay relevant. So if you are an organization and you made it through a crisis, okay, you need to rebrand. I'll give you guys a perfect example. A couple of decades ago, someone was tampering with Tylenol. This was a documentary I just watched on Netflix, and it's just perfect. So, someone had tampered with capsules, Tylenol. Now, Tylenol at the time was probably one of the only major over the counter, medicines for pain and fever. So it was really, really popular. And what happened was people were dying. And at first they didn't know what was going on until an investigation was done. And, they realized everybody had recently taken Tylenol. And when they evaluated the Tylenol, what they saw was somebody had took the capsules, opened it, dumped all the medication out, and they was putting cyanide into the capsules and putting it back into the Tylenol bottle, closing it and putting it back on the shelf. So at this time, there was no tamper resistant cover. You know how when you open medicine, it has a cover that you have to, take off for you to get to the medicine? At that time, Tylenol didn't have that. So you could just open a bottle of medication and the pills are right there. There's no seal. Because what does the seal say? If the seal is broken, discard, don't use. So before this, there was no seal. So thankfully, this situation did not bankrupt Tylenol because this could have easily went bad. Tylenol is still here. They did an investigation. They realized that it was not Tylenol because they were thinking was somebody at Tylenol plant doing this purposely. Thankfully, the investigation showed it did not happen at the Tylenol plant. So somebody was going into random stores, putting cyanide into Tylenol capsules and putting them back onto the shelf. So when you go to purchase a medication, you have no idea you're purchasing something somebody just tampered with. So what Tylenol did after the situation blowed over, they arrested somebody. I think the case was still open, but once Tylenol was cleared of any wrongdoing, they decided let's do a tamper resistant seal. From now on, all of our medication will have some type of a seal that you have to break in order to get to the medication. And if the seal is already broken when you purchased it, you toss it, you bring it back, we'll get you a new one. So when it comes to organizational crises, you kind of learn from your mistakes and you change policies and you change procedures so you are better equipped to not only prevent a crisis from happening and again, or reduce the risk of a crisis happening again, but you are better equipped to handle it if it does happen. Okay. So that's it for the 4 stages. Okay. It is 10:20. So make a great time. It is 10:20. Let's take another breather and then we will go through crisis intervention and then we'll go right into our NCLEX questions. Okay, hopefully everybody is back. Let's finish with crisis intervention, and then we're going to jump right into our NCLEX questions. So, crisis intervention is how you, as the nurse, can step in, okay, to help people that are dealing with a crisis. If you do go into mental health, this would be a component of work responsibilities. A lot of times people, call crisis hotlines, they go to centers, they check themselves in if they have, the awareness that they're dealing with something. So it is very important that you know how to prioritize care, that you know how to therapeutically respond, and you know what type of support the client would need through that particular crisis that they're dealing with. So, when it comes to crisis management or crisis intervention, okay, these are the typical building steps of how you deal with the client. Now, of course, there's no exact blueprint, okay, because everybody responds to things differently. Everybody needs different types of assistance and help. But this just gives you kind of a general idea of what's going on with the client. So the first thing is you need to assess the situation. Now, this is also some good NCLEX test taking tips also. You cannot do an action until you've done an assessment. Okay, so it doesn't even matter if it is a mental question or not. If you do come across a question and it's asking, what to do first, what is a priority or what the nurse should do, you have to determine was an assessment first done. You cannot do an action until you've done an assessment. So the very first step is to always assess the situation. See what is going on with the client. Okay. And then you also want to establish rapport. That also means trust. Okay. It's very hard to deal with a person that's going through a crisis. And let's say they have a lot of anxiety or they're, having an emotional breakdown, mental breakdown. You definitely need to establish trust and rapport with the client. They're more likely to open up to you because that is the goal. When you're dealing with a crisis or a victim of a crisis, you want to open up the lines of communication. You want them to elaborate so you can know how to best help them. Okay, because a lot of times people shut down when they go through stuff, and I know some of you know what I'm talking about. You're going through something and you just don't want to be bothered, and you just shut down completely. In a lot of situations, sometimes you just need a moment to yourself, but then there's other situations where shutting down is not healthy. So when you are dealing with a client, you just want to build rapport so they can open up and talk to you. Okay, you want to find out what you need to immediately do. Now, keep in mind, there's a lot of things that you would do for your client, right, to help them through a crisis. But in that immediate moment, what is the most important thing for you to take care of? What is the acute need, the right now need? Okay. That is what will be the priority. That is what would be important or the first step for you to, take when dealing with this client. Everything else kind of comes after you've settled the immediate need of the client. Okay. Emotions, you want to process those, see how the client is doing. Okay. Options that the client has to work through the crises, if it's financial, do they have any support system that can help them? Are there resources that can help them? Like, for example, when a lot of people lost their jobs during COVID, people still needed to feed their families. They still had to buy gas. They still had to pay bills. So there were a lot of programs and resources that kind of popped up for individuals to help them through that time period. Okay. You also want to create a plan. Sometimes getting out of a crisis is just as simple as planning your next steps. Okay. How am I going to do this? How am I going to handle this? Instead of just jumping in head on, sit down and kind of work a plan of action. Okay. And then you always follow up with the client. I remember that we had a client, domestic violence, and the client was a frequent flyer, meaning the client would always come in through the ER, and I would float to the ER a lot. So I just so happened to be there on at least two occasions when a client came through after, experiencing abuse. And it was like to the point where, as okay, we need to put together a plan for you. Because if you do decide to leave, and here's the thing, of course, the client needs to leave the situation, but you can't force anybody to leave. You can't make anybody leave. So the best thing that we could do for this client, listen, here's a list of shelters. that have availability. You know, we'll give you the names of them, we'll give you the location, the phone numbers. You know, they take kids. These particular shelters take pets. So, you know, here's all your options. Okay. Try to get a track phone, a phone that you can't trace. You know, don't use credit cards. Try to, you know, put cash away little by little. That was the plan that we had to put together for her. And we did a follow up to see how she was doing. And the last I heard with that first follow up was that, you know, she was doing okay. She finally did leave. It was a little touchy because there was kids involved, but she had a plan. And in my opinion, the reason why she never really left the situation to begin with, because she didn't have a plan in place. You know, she didn't know what to do. She didn't know where to go. She didn't know how to protect herself. She didn't know how to protect the kids. So she stayed in a situation she shouldn't have stayed in. But it's like once a plan was put together and these are your options, it kind of felt like maybe she, you know, okay, now I can actually do something because I have a plan now. So a lot of times planning with the client to help resolve the crises and just following up to see how they're doing, to see if the plan worked, to see if there's anything else we need to work on, that goes a long way for clients that are dealing with a crisis. So these are the actual steps for managing a crisis. Okay. So these are the steps you go in these orders as the nurse helping a client through a crisis. And this is how we help to resolve it. So you first, again, you need to identify the problem. Okay. You need to identify the crises, try to get as specific as you possibly can, because the more specific you are, the better you can help the client, the better you can direct them into the direction for care, resources that are available, the more information that you have when you are defining the situation. Okay. You're also going to get the client's perspective. Okay. A lot of times, if it's a mental crisis, you know, it's not something I could put my hands on. Like, for example, if the client had a medical diagnosis, you know, it could be a mental crisis, it could be an emotional crisis. So, a spiritual crisis. A lot of people go through a spiritual crisis when it deals with their spirituality and religion and their faith. So, sometimes the client has to give you their perspective. And again, you want to have that therapeutic communication, that rapport, that trust, so that they are able to open up to you better. Okay. Safety is always a top priority when you have a person dealing with a crisis. Okay. You want to assess the immediate needs. Okay. Sometimes when people go through crises, you know, they're angry, they can self harm, they can harm others, they can be angry and they want to harm others. You know, that is something that you have to address first before you move forward. Okay, providing support. Sometimes as a nurse, you could just be there emotionally, you know, listen to the client. If they need to vent, if they need to get something off their chest, that is where you step in. And sometimes in listening ear, it goes a long way. Just having somebody to talk to and just release frustrations or whatever the client may be feeling. That is where you come in as a strong support system. Validating is also important. Okay. A lot of times people don't say anything because they feel like nobody's going to believe them. They feel like somebody might think they're lying. So they deal with things. They go through a crisis without getting the proper help and support because they don't speak up. So, as the nurse, your job is to not only provide emotional support, but to validate and tell the clients their feelings are valid. You know, don't feel ashamed for how you feel. You have a right to feel the way that you feel, and we're going to work through it. So simple and straight to the point. Okay. Alternatives. Okay. Coping mechanisms, options. This is where we kind of explore. A lot of times you need another perspective to help you see things that you didn't realize. Okay. A lot of times people don't know they have options because they didn't think about it. Or a lot of times people do not know of resources that are available to help them because some people just have a lack of knowledge. As a nurse, your job is to have that knowledge. Your job is to be able to point the client in the right direction to get them the help that they need, to give them, you know, referrals for extra care and help. Okay. We already talked about planning. A lot of times people don't know how to deal with a crisis because they don't have a plan to deal with a crisis. So when you do some proper planning and you have your resources, a lot of times people are better equipped to handle a crisis because they have a plan in place. Okay. And lastly, commitment. You have to follow through the plan. A plan that is well thought out, but it's not executed. It's just a waste. So sometimes for the client, they have to acknowledge there is a problem. They have to acknowledge that I'm in a crisis. And they often have to say, you know what, I'm going to stick to it. I'm going to pull myself out of this. A lot of times when people are in denial, which is again a defense mechanism, it's really hard to pull them out of a crisis because again the denial, like they don't even acknowledge that there is a problem, that there is something happening, that they are going through something. So a lot of times you have to have the commitment and the acknowledgement from the client to follow through with whatever it is that you come up with to help them deal with whatever crises that they are going through. Okay, and that is the end for our presentation. Any questions? Let me look to see who's here. I see some people have showed up. Wow. I see some familiar faces. Hello, hello, hello. Okay, so let's jump into our questions. So, for those of you who are joining me for the very first time, I do encourage students to interact. Of course, I love interaction. You can always, type into the chat. Of course, if you have questions, I do check the chat periodically. You can type your answers. You can unmute, okay, and give your answers. You can ask questions. If you want me to go back and look at another slide, just please, always, always just let me know, okay? So I can definitely help you. So before I do that, okay, I am going to post the link for tonight's webinar. Okay, so what you guys are going to do, you guys are going to click on this link and give your feedback for tonight's webinar. Okay, anyone who knows I love some feedback, let us know what you like, let us know what you didn't like. If you have any suggestions, please utilize this link. Your voices are always heard. Okay, so the link is there in the chat for you guys to click on and give your feedback. Now, I'm going to share my screen so we can get into our NCLEX questions. Okay, now before we start with the questions, let me get into slideshow view. Okay, I always take time to talk about NCLEX prep and NCLEX planning. Okay, so those of you who are, in the process of preparing to take the NCLEX, if you're wondering, there is no right way to study for the NCLEX. Okay, I do NCLEX prep with students, and that's one of the main questions students ask: how to study for the NCLEX, what to study. Honestly, there is no correct answer because when you sit down to take your NCLEX, you have no idea what type of question you're going to get. You're going to have no idea where the question is going to come from. Is it going to be med surg? Is it going to be mental health? Is it going to be maternity, peds, fundamentals? You literally have no clue whatsoever. Okay, so when you are prepping for the NCLEX, the best thing that you guys can do is just practice questions every single day. That's it. The goal is to get comfortable with questions because, again, you're not going to know everything. Okay, some things you might not know, and that's okay. Okay, it's not about knowing everything to pass the NCLEX. You just need to know enough that you know how to take care of somebody safely. Okay, so when it comes to prepping, you want to make sure that you have a product that is going to give you enough questions to practice every day. And I usually tell students about 50 to 100 questions per day. Okay, that is what you're going to do to help. Now, if those of you who haven't already, you can always explore Naxlex. I do have experience with a lot of products, being that I do teach nursing and I do NCLEX prep, and I can honestly say Naxlex has a great product. They have about 3,500 questions. That is a lot. You definitely want a product with a big test bank because if you're doing 50 to 100 questions a day, I've had some students do 200 a day. That's a little ambitious. You might not be able to do 200 a day, but you have to practice at least 50 every day to get comfortable until you actually do take your NCLEX. Okay, they have a 14-day free trial, so you can always look around, see how the products work for you, see if you like it. Okay, you have a 30-day subscription and then you have a 90-day subscription. Okay, so you have options of what works for you, but remember, you're going to have to practice questions every day, rationales for your answers. That is how you're going to prepare for the NCLEX. You don't, study P's. You don't review maternity. You just sit down and just practice questions as they come to you. Okay, so that is my best advice for anybody that's prepping for the NCLEX. You just have to have a good product to support your questions daily. Okay, get your feedback, read your feedback so you know your weak areas, you know your strong areas. And again, that's all you really need to do to prepare. Okay, so let's get into these questions. Now, I'm going to read the questions. We're going to go through the answers. You guys post your answers in the chat. You can always unmute and verbalize your answers, and let's see what you guys got. So, question number one. A nurse is counseling a client at a crisis center after the client's house burned down and the client's child was killed. Which action by the nurse is a priority? A. Determining next of kin to notify of client's admission. B. Assisting in psychological resolution of the immediate crisis. C. Establishing a basis for long-term therapy. D. Uh, Providing a basis for admission to an acute care facility. So remember, one of the things we talked about, crisis management, the immediate need. Okay, so what do we need to first immediately do for this client? So let me see into the chat. I'm seeing a lot of bees, 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 bees. Okay, so let's see where we are. The correct answer absolutely is B. Okay, so again, the goal is to go over the immediate issue. Okay, and the immediate issue is you have a client. I'm going to go back so we can see the answers. So the immediate issue is you have a client whose house burnt down and the client had experienced a death, a child. Okay. For any parent, that is going to be emotionally, mentally, physically, spiritually, every type of emotion you can think of, a person would experience losing a child in such a traumatic way. So the immediate need for this client, okay, psychological resolution, a psychological assessment, okay, to see where the client, what if the client is suicidal? After this has happened. And you can understand how that, could be, the situation. So I need to evaluate this client because what if I need to place this client on suicidal watch? Okay. That is where the thinking is when it comes to this type of question. So good job, you guys, for B. Question number two. A 40-year-old executive who was unexpectedly laid off from work 2 days earlier reports fatigue and an inability to cope. The client admits drinking excessively over the previous 48 hours. This behavior is an example of A, PTSD, post traumatic stress disorder, a manic episode, C, depression, D, situational crises. So, laid off 2 days ago, unexpectedly, has been drinking heavily ever since. So, what is this an example of? What is going on with this client in this situation? I see D, I see A. Okay, any other options? I see D, I see A. Okay, so let's see where we are. Correct answer is D. Great job, whoever put D. Let me go back and look. You don't have a name, there's just a number there, but good job. So let's go back and first look at our answer options. Okay. Now, somebody put A, and honestly, that wasn't a horrible option, but this is a good teaching opportunity for NCLEX. Now, that is more of I want to say an assertion. Okay. There's not really a lot of evidence that tells you this client is experiencing PTSD. Usually for PTSD, it is usually something that is a little more profound. when it comes to the response. Um, this client, it just happened 2 days ago. They are drinking. However, this is more of a situational crisis. Remember, this is something that happened unexpectedly. It's causing not only emotional distress, but possibly financial distress. And it is more of a situation crisis than it is post traumatic stress. There's not enough evidence to declare that this client is experiencing post traumatic stress disorder. Okay. The response is a little more than just drinking. Okay. You're talking about mental disturbances. The client is not there yet. Okay. Because they're more or less just getting over the shock, probably, of losing their job unexpectedly, especially if it was something that they totally did not see coming. Okay. And they weren't prepared for it. Okay. So this is more of a situational crisis than it is post traumatic stress. But let's say the client is not able to find a job, or the experience of finding a job hunting is, is a lot, is not pleasant. They're having a hard time. And that could lead to post traumatic stress. But this is just, a situational crisis. Okay. Question number 3. The nurse is managing the care of a client in a disaster shelter who broke their femur and has lost their family home in a hurricane. What measures should the nurse take? Select all that apply. A. Supervise the care provided to the client during the crisis. B. Obtain a prescription for antipsychotic medications for the client. C. Act as a client advocate for the client in crisis. D. Discuss with the interdisciplinary team community resources that are available for the client. E. Obtain accurate identification, including name, age, address, contact information, and names of relatives. So you are working at a disaster shelter. This is your client. What should you do to help this client through this crisis? Select all that apply. Let me see. C, D, and E. Okay. I see A, C, D, E. Okay, so we are at least in agreement, C, D, and E, but then I see an A there also. Okay, so let's see. The correct answer is yes, A, C, D, and E. Okay. So supervising the care, you're just making sure, that the client, because now think about it. A lot of times when you have a disaster, a lot of times those are volunteers, right? People that are just there to help. It's an issue. It's a lot of people need help. So people volunteer, which is what you want, right? So these may not be individuals that can really, really take care or help the client because they're in a disaster shelter. It's not like they're in a healthcare facility. So, as the nurse, as the healthcare professional, you definitely want to supervise and make sure that the client is getting the right help, that they are triaging appropriately to determine what type of help what person gets. Okay. B is not the answer. There's no indication that the client needs antipsychotic medications. Okay. Even if this is a serious situation, even if the client, extreme loss, does not say that they are having a psychotic break. Okay. The NCLEX will do that. They will put answer options and you kind of like back and forth. Yes, this could potentially head in that direction, but there's not enough in the, question. There's not enough information for you to determine this client is experiencing a psychotic break. They need antipsychotic medications. Okay. So you never assume. You base your answer on exactly the information that you are given. C, of course, is important. You are an advocate. That's what nurses do, especially for a crisis. You want to make sure the client is able to get the resources and get the help that they need. Okay. And lastly, E, I might need to contact next of kin. Okay. I might need to let somebody know that you are alive because somebody might be looking for the client. Because a lot of times we have disasters and crises, natural disasters. People get separated, people get hurt, people are unfortunately unalived. So you may have somebody worried about this client. So you definitely want to get the correct information. Okay. So you can notify somebody or next to kin, a friend, somebody that the client is there in the shelter. Okay. Number 4. The crisis intervention nurse is working with a client who is diagnosed with situational depression after returning home after dropping off her son to college. The client states, I won't allow myself to cry anymore because my crying upsets the whole family. This is an example of which defense mechanism? A, denial, B, repression, C, rationalization, D, displacement. So, what type of defense mechanism is the client experiencing? I see B, I see C, I see B. So, we're kind of back and forth between B and C. Okay. The correct answer is C. Good job to whoever put C. So let's go back and look at our answer. So the client is not in denial. Okay. There is an acknowledgement that the child was dropped off to school. The client is sad. So they're not in denial about the situation. So that's not the answer. Now, remember, repression is kind of when you kind of like you put something to the back of your mind, right? It's like it's so painful that you kind of just throw it into a lockbox in your head. A lot of times people repress memories without even thinking about it. It was so traumatic that they kind of just removed the memory and locked it away. They can forget it even happened, living their life like it never happened. And then, something triggers or brings up memories. That is what repression is. Okay. Now, this is rationalization. The client is acknowledging that she cries a lot. The client is, um, given a valid reason for why she's not going to cry anymore. And it makes sense, The other family is probably just over it. She probably been crying the whole ride home. And they like, oh my God, he's just like, a couple of hours away. It's not that serious. He can hop on a plane and come home quick. So, the other family probably is annoyed. So, she's rationalizing, what, I'm not going to cry because my family is upset. Not, what, I'm not going to cry because I don't want to make myself upset anymore. I knew he was going away to school. So, I'm upset he's gone, but I know I'll be all right. She's rationalizing her, crying because it's going to upset the family, not because for her benefit. So that is rationalization. And displacement is when you kind of just put your feelings off on someone else or you target someone else. That's not what she's doing. She's acknowledging her crying. Okay, so that is definitely rationalization. Question number 5. A nurse is developing a care plan for a client who is a single parent. The client is experiencing anxiety after the loss of a job and is verbalizing concerns regarding the ability to meet role expectations and financial obligations. What is the most important for the nurse to include in the plan of care? So, this is a client, lost a job, experiencing a potential financial crisis. Okay, so keep that in mind. What is most important? Okay, interview family members to determine the dynamics of the family relationships. Explore the client's obsessive thoughts that are resulting in high anxiety. Ask the client about plans for managing the financial obligations. Determine the client's ability to cope with the job loss and family obligations. So, this is a tough one. Now, when you have a question like this that's asking what's most important, you're not saying that the other options are not important. Okay, because there could be more than one thing that the nurse can do. The question is simply saying, out of all of these options, what is most important for the nurse to include in a plan of care? Meaning, if I pick one of these to include, it would be the most important. Okay, so let's see what we got in the chat. I see a lot of D's, a lot of D's, a lot of D's. And the correct answer is yes, D. Okay. So the very first thing and the most important thing, determine the client's ability to cope with the job loss and family obligations. Effective coping strategies. That is going to be important for seeing how the client manages over the next couple of days. because this is a real life crisis. This is something that is important. She lost her job. She's a single parent. There's financial obligations, regardless of whether you have a job or not. The bills are not going to stop coming. So, how are you going to manage these next couple of days? Okay, that is going to set the tone for everything else. Because if this client is not going to cope well, the nurse needs to say, okay, this is a possibility. These are some options we can go with. Okay. A, B, and C are important. They may be something that you could do, but again, it is most important to include D in the plan of care. Okay. Um, B is actually not pretty bad because this is where you establish therapeutic communication by getting the client to, talk about what they're feeling, which will give you a better idea how to help them. It's just that the way B is worded, saying that the client's thoughts are obsessive, that is what makes it incorrect because the client thoughts are not obsessive. Okay. The client has a real life crisis, so it is understandable that the client is worried about what the future is going to happen. Okay. Question number 6, an adolescent client who is being seen by the crisis nurse after making several superficial cuts on their wrist states all of their friends are siding with their ex-partner and will not talk to the client anymore. The client says that although they know the relationship is over, if I can't have my ex, no one else will. Which client problem takes the highest priority? A, risk for other directed violence. B, situational low self esteem. C, risk for suicide. D, risk prone health behavior. So, this is another good one. So, again, this is a priority question. What is the most important? The immediate need right at this moment. Immediate need is the priority. Okay. So, let's see what we got in the chat. A lot of C's, a lot of C's. Okay. So let's see. I think that's a D. C's. Okay. So let's see. The correct answer is A. And nobody picked A. So let's talk about it. Okay. The reason why I'm going to go back so you can see the answer. So let me say why A. Now, those of you who pick C, I definitely get it. Um, the client made cuts. Okay. They're superficial. Believe it or not, that is important because superficial, um, they didn't cut deep, you ain't hit no arteries. It's almost like the client didn't really want to commit suicide. It could have been, and this is how you have to think, it could have been a teaching attention seeking, but there is no immediate need right now at the moment because the client is not talking about suicidal ideations. Okay. Yes, the client has made cuts in the past, but at this exact moment, there is no indication that the client is suicidal. It may, even though it happened in the past. Now, the client did state, if I can't have my ex, nobody. So as of this moment, the client is actively saying, I'm going to hurt somebody else. Okay. The client acknowledged the relationship is over. However, they are still angry. They are still hurt. They're an adolescent dealing with a wide emotional feelings, and they are looking to harm somebody else. The risk for violence towards someone else, that is the immediate need. Okay. Because it appears that the client is not having suicidal ideations at the moment. They're having thoughts of hurting somebody else. Okay. Um, if you were to have a conversation with a client and they are projecting that they may have suicidal ideations, then the answer could have been C. But the question does not state that that happened. The question, remember, you focus on what is currently happening. Okay. They want to hurt somebody else. That would be the priority to take care of. All of that other stuff comes after you immediately address the need to want to hurt somebody else. Okay. Because remember, safety is one of the key things we try to protect when you have a client going through a crisis. Question number 7. At an emergency shelter, a client who has experienced an earthquake that damaged their home tells the crisis intervention nurse that they are going to spend the night in their own bed at home. Which defense mechanism is the client exhibiting? A, repression, B, denial, C, rationalization, D, displacement. Okay. Client in a hurricane destroyed the home. The client says, I'm going to go home and sleep in my own bed after the earthquake damaged their home. Let's see in the chat. Okay. I see B's and I see A's. Okay. B and A's. Let's see what the correct answer is. This is denial. Good job. Okay. The earthquake has damaged the client's home. There is no home, it is damaged, or it may not be safe for the client to go back to the home because the house is damaged. So you cannot go back and sleep in your own bed. You have experienced a disaster. Your home has been affected. It is probably not safe for you to go back. So the client is not acknowledging this occurred. The client is not acknowledging that their home has been destroyed or again affected, and they just want to go home and they can't. So they're not acknowledging the situation. They are in denial. For the person who put repression, it's not, I get it. I get why you pick repression because it's almost like they just put it to the back of their mind that this happened and I'm going to go home. But that's not necessarily what repression is. When you have an unpleasant memory or an unpleasant experience that has caused you mental distress, mental emotional distress, and you kind of, had that breakdown and you just kind of repressed that memory. This client is probably in shock. Let's start there. This is more shock than anything. And because they are probably still in shock, they are in denial. It's like they haven't accepted that this has happened. Okay. So that's why the answer is denial and not repression. Okay. Question number 8. Which crises intervention strategies would be therapeutic for a client being admitted to the unit to threat serious injuries is supposed to be treat following an abusive incident with the client's spouse? Okay, so you have a client in the hospital. What would be therapeutic? Abusive spousal incident. The nurse knows the client has been admitted to the unit before for similar incidents. Select all that apply. A, support the client's attempts to discuss feelings. B, touch the client to provide contact with reality. C, respect the client's personal space. D, reassure the client of safety. E, confront the client's ineffective coping behaviors. So again, this is a client being treated for injuries, severe injuries, serious injuries sustained from a domestic violence incident. The nurse knows this is not the client's first time being here. So this is a situation a client has been in before and got treated before, and it appears to have gone back to the abusive spouse. So without being judgmental, what is it that we would do for this client? Okay, I'm looking in the chat. I see ADE, AD, ADE. Okay, so let's see. Our correct answers are ACD. Okay, and let's talk about why that is the correct answer. So first, let's go to E because somebody did put E. Now, the term confront is why that answer is wrong. Okay, so you have a client that's been in a domestic violence situation, very serious injuries. The client could be very anxious. The client could be, on edge, still upset. Confronting is a little threatening. Okay, when you confront someone, I don't want to say it's like an ambush, but that could send the person into defense mode. It's like it's judgmental. And remember, we're not there to judge, we're there to help. So confronting is the wrong word to use. Now, if it was a discussion, okay, that's different. But then you also can't assume that the client has ineffective coping strategies. Yes, the client keeps going back apparently, from the question. However, that doesn't necessarily mean that the client has ineffective coping skills. Okay. It could be another reason why the client keeps going back. It doesn't say why, but it could be a number of things. It could be kids, it could be a financial issue, she could be afraid. So that's not necessarily that she has ineffective coping skills. So that's kind of like almost an assumption for E. Okay. B is not appropriate. She's on edge. She just got out of an abusive situation. Touching might kind of send her over the edge. She's when you have like panic or anxiety, you become hypersensitive. So instead of touching the client, you can respect personal space and just let the client know, listen, I am here. You are safe. You're not alone. I am here. I'm the nurse. I'm going to take care of you. Okay. It's almost like if a person is blind, you don't just touch them, right? You have to say, I'm here. This is nurse so and so. I'm in your room. I'm going to be approaching you. It's like you have to let them know that you are there so you don't startle them. This is the same situation. When you have a client that's in this situation, you don't want to startle, you don't want to upset. So you want to respect space and just, hey, I'm here if you need me. Okay. Oh, and also it's very important the therapeutic communication, getting the client to talk about what happened. Again, maybe they're not leaving because they need a plan, they need help, they're afraid, they don't know where they can go with their kids. That is why you have to talk to the client, get them to talk about the feelings, talk about the situation, and then you can help put together a plan of care. Okay. Question number 9. The campus health nurse is caring for a client after they were sexually assaulted. Which of the following crises intervention strategies would be most beneficial for this client? A. Advise the client to take martial art lessons. B. Agree when the client states, I should just move on. C. Explore the client's strength and resources with them. D. Assess for negative coping behaviors. So, college student just been sexually assaulted. What is the best, most beneficial thing that I could do for this client? And let me see in the chat, I have C's and D's. Okay, C's and D's. Let's see what the correct answer is. The correct answer is C. Okay, so the goal when you go through a crisis is to help with resolution. Okay, um, with this particular situation, putting together a plan. Okay, we want to know what the client's strengths are. We want to know what do you already have situated in place because I need to know how to help you. Okay. If you have a strong support system, that is a strength because you're going to need support to help you. Now, you're in college, your family might be hours away. Okay, that's not necessarily a strength because that is your support system. So instead, is there another way to get you the support that you need immediately? Because of course, we can call your parents. You can say, "Hey, we have your daughter. She gave us permission to call you. She's been sexually assaulted, and this, that." How long is it going to take for someone to get there? So that is a weakness. You don't have a strong support system immediately available to help. So what do you have? What strengths do you have? Okay. What resources do you have access to? Do you have health insurance? Okay. Because you may need services down the line. You've been sexually assaulted. This is the type of situation that causes post traumatic stress disorder. Okay. After we treat you, what about long term recovery? Okay. What about your mental health following? Are you going to have anxiety? Are you going to develop depression? Okay. Are you going to be hyper vigilant? Meaning everywhere you go, you're kind of thinking, okay, this can happen to me again. So you're overly sensitive. You're overly kind of looking around, and you could be even, falsely judging people that you think may hurt you because you went through this situation. So it is best to see what this client has going for them so we can help them properly. Now, negative coping behaviors, that is definitely something that you would do because we want to know how is the client going to cope, but it is better to look for the positives, to look for the good. Okay. Once I assess how is the client going to manage or cope, then I can check for the negative because I first have to assess it. Okay. I first have to make sure that the client is okay. I first have to make sure that what resources you have, what support you have, then we can go and do everything else. But it is most beneficial to see, okay, how can I help this client? And then we go into the other stuff. Okay. And the last question, number 10. 32 children are brought to the emergency department after a school bus crash. Two children were killed along with three people in the car. Who caused the crash? Before the clients arrive, in addition to ensuring that the hospital staff is prepared for the emergency, the nurse should anticipate carrying out which crisis intervention step? A, calling the nearest crisis response team. B, contact the school to get the names of the client's caregivers. C, notifying the hospital volunteer office. D, calling the school to inform teachers of the crash. So, 32 children incoming. There were some deaths. So, this is traumatic. You don't know what type of injuries you have. Pretty soon, some parents going to be showing up because they're going to hear about the crash. So, how do we move forward from this situation? And in the chat, I see A's, 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 and a C. The correct answer is A. Perfect. 32 children is a lot. That's a lot of people. You have some deaths, you have some serious injuries. Okay. You may have some kids that are perfectly fine. You don't know what it is you're about to get into. So you want to call the response team. Okay. It is going to be more than just taking care of these kids. Okay. Parents are going to have to be notified pretty soon. It's going to be a flow of people. You may have news reporters, covering the incident. Again, parents, because I know if it was my kid in a bad crash and I heard there were some deaths, I don't know, is it my kid? I don't know what's going on. So, of course, I'm rushing to the hospital and I want answers. Where's my kid? So, you can definitely, if you are a parent, you can understand. You need somebody to help manage that. Okay. People who are, trained to handle a mass situation like that. Okay. You see crises intervention teams whenever there's a big issue that, is of a magnitude size, and you're going to have a lot of responsibilities when it comes to clients or treating people. You definitely need a crisis response team to, free up the care that needs to be given to these kids so they can manage all the other stuff again, like all the parents and caregivers that are going to show up. Because guess what? Somebody is going to be told your kid did not make it. Okay. So that is it for our NCLEX questions. Were there any questions regarding crisis management? Now, remember again for the NCLEX, okay, knowing how to handle crises, knowing how to best help your clients, very important. Safety is a category on the NCLEX, and a lot of your safety questions comes from mental health. So, how to therapeutically respond to clients, how to assess them, what to assess, how to plan, what is, the appropriate actions to take. Tough questions. I know you when it comes to stuff like this, it is tough because it's mental health. It's not something you could put your finger on. A lot of times it's a lot of evaluation. What works for one person is not going to work for the other, and you kind of have to take your personal out of it because a lot of times when it comes to mental health, you know how you feel about things, you know how you would go about doing things, but you have to remember, okay, this is not about me. I got to put myself out of it. I have to be unbiased, and I just have to focus on the client's needs. Okay. That is what we talk about. We talk about safety. Okay. It's not, listen, crisis, but you know what? It's a great topic because, like I said, we all have experienced crises. Listen, y'all, okay? The ones that's getting ready for the NCLEX, listen, it's a crisis. It's situational. Okay. You about to take a hard test. You're probably anxious. Okay. It's a, you feel a type of way. You're not 100% sure. I don't know nobody who's 100% sure going into the NCLEX. You feel okay, but since you don't know what's gonna happen, you're not 100% because you're just going to sit down and just start answering questions. And that can cause an anxiety, that can cause the emotional distress. And it's, it's a good crisis, but it's still a crisis nonetheless. So it's really hard to deal with crises because they don't always bring about good feelings. So yes, this is a difficult topic, but you have to be prepared. And a lot of times you got to take your feelings out of it. Okay. You guys, when you start working with clients and you start coming across those really tough situations, it's like, okay, I don't have time to be personal or judgmental. I just have to be unbiased and just treat my client and take care of my client, whatever it is that they need. Okay. If there are no more questions, oh, let me see into the chat, Yeah, this is a good, this is a big one. So, and we come back next Sunday, I'm getting into the hard stuff. Okay, so if you join me next Sunday, you'll see we're gonna be talking about, if I'm not mistaken, grief and stuff like that. So we are covering some tough mental topics coming up. So if there's no more questions, okay, I appreciate you guys. Remember, please look into the chat. I'm going to post the link one more time for you guys who didn't catch it the first time. Okay, please click on this link, leave your feedback, what you enjoyed, what you did not enjoy. If you guys, you're welcome, Roshana, and I'm nice to see you again. What it is you guys want to see more of, your voices are definitely heard, I can assure you. Okay, you guys are so welcomed. I will see you guys hopefully Wednesday. I'm covering ear related disorders. Okay, very important from babies all the way up to older people. So if there's no more questions, you guys have a wonderful evening, and hopefully I will see you guys on Wednesday. Bye, you guys. Have a great night.